This is Just Listen, hosted by George. Today is October 13th, 2025. Welcome to the podcast. I'd like to thank folks. I put a new picture on Facebook, and a lot of people commented on it and said that was a nice picture. Thank you very much. For a 61-year-old, that's good to hear. Okay, so today I want to talk about the U.S. federal government policy on healthcare policy for individuals regardless of their immigration status. Last week, I got specific about the subsidies and why we were having a shutdown. It made me realize that I wanted to get more information and to present it to you about how Congress, the legislative branch, and the executive branch are at odds. So, healthcare policy in the United States involves a mixed system of public and private insurance with a significant role in funding and regulating healthcare through programs like Medicare, Medicaid, and the Affordable Care Act. Now, I would submit to you that the original intent of these laws were to support lower income citizens and people here legally in the United States. As you are aware of, we have probably one of the most complex immigration policies in the world with what I would call loopholes. Now, the last 5 years or so, things have really changed from the perspective of who is eligible to get these services. Now, I want to start with something called, and I alluded to it last podcast with this federal poverty level chart. So quickly here. So for a family of two, for 2025 is $21,150. Okay, so let's start with family of four for $32,150. Okay, so if you make more than $32,150, you are not considered below the federal poverty level. Now, why is this important? There was a shift from low income, middle income, high income to this federal poverty level chart here. So for you to be, so if you're in a family of 8, you have to make under $54,150. Okay, well, let's go with that and see, well, who qualifies as a family? How are you considered a family? So, a family counts as a family member if it's you and your spouse, regardless of their financial independence, which basically says, well, hey, somebody might not be working. So you include all children. We all know that. Now, here's something that you might not know. So other relatives such as parents or siblings can be included if they are dependent on you and your spouse for at least half of their financial support. And then typically you don't count non-relatives, so I won't go through that, but you could. So you also consider financial dependence, household versus family, and all that means for relatives to be included, they must be financially dependent on you and your spouse. Household versus family. While some programs use household definition for FPL purposes, the focus is on family size as defined by related individuals' independence. Now, you can see already that there are so many variations, and the original essence of the federal poverty level has just totally changed. So let's fast forward to, say, the last 10 years here. Who do you think would qualify for these benefits from the federal government? So we can, and I had to look at my own children and say, okay, so if only one person was working in O'Fallon, Illinois, the minimum wage is $15. So how could they possibly qualify for any of the health care benefits? So just looking at the data in itself, you can see why you would form an opinion of who they're actually targeting, especially the last 4 years. So let me give you some more information. So, in case you didn't know, illegal immigrants largely obtain health care through a patchwork system of emergency services, state-funded programs, community health centers, and in some cases, private insurance. Undocumented immigrants are not eligible for federally funded programs. Okay, you say that, but the devil is in the details. Emergency services. Federal law requires almost all hospitals to provide emergency medical treatment to anyone who arrives at an emergency department, regardless of their immigration status, insurance coverage, or ability to pay. Now, this was a huge deal about 15 years ago, and that's why in some communities, hospitals moved out of the area, because if they can't bill anyone, they lose money, and then they could go out of business. That happened in Belleville with St. Elizabeth's. That was the reason why they moved, because there was people coming in there. Now, expand that to people who are just now in the country. Now, we want to help people. Let me say that up front. The system is supposed to help people in emergency situations. But remember, if they're here illegally, they shouldn't they should never have had the chance to access any of these healthcare systems. Now, if you're here legally, that's totally different, and Congress passed that, so it was the will of most of the people in the United States. Because I want to make sure that everyone knows, if you're here legally, I'm not saying that you're not authorized to get these services. What I am saying is that with younger people starting families, this federal poverty level, when they're spending millions and billions of dollars, they can't access it because they're not going to traditionally make under $40,000 or $50,000 a year, because people, U.S. citizens, are working hard. Young people are working hard. Most of them are. So I'm trying to differentiate and tell you that the evidence points toward these sources, at least in the last 10 years, being for people who are in the country illegally to access health care. So, state and local governments, I researched, were getting federal money from Congress because they passed the initiatives like that, enhanced subsidies and all of that stuff. So there were 19 states really pulling from that. So if you couldn't guess, one of them was California, and the other one was Washington State, and of course Illinois was in there too. So Illinois just changed their laws for giving out health care because once the money stopped from the federal government, with their budget concerns, they couldn't do it. Now, when we're talking about coverage for children and pregnant people, as you know, you were hearing that people were coming to the U.S. to have kids, to make them U.S. citizens, and for federal dollars to go towards the births. Now, as you are aware, that insurance for some people is tough when they're having kids. And so U.S. citizens who need help should be getting it first, but that'll be for another show. Now, so how are illegal immigrants getting care in rural areas? So they getting access to health care through a patchwork system of emergency rooms, community health centers, migrant health centers, and in some cases, private insurance. Okay. Because on the surface, it says that they're ineligible for federal programs. Now, here's something that you probably didn't know. There's something called federally qualified health centers. These centers receive federal grants to provide comprehensive primary care, dental care, and mental health services to underserved communities, including immigrants, regardless of their immigration status or ability to pay. Did you know that? Then they have something called the migrant health centers. These are a subset of the fully qualified health centers specifically funded to provide culturally and linguistically appropriate care to migrant and seasonal farm workers and their families. Well, who do you think would be using that money for care of migrant and seasonal farm workers? Want to be California. California, as you are aware, maybe you're not aware, they are an agricultural juggernaut. They export a lot to other South American countries, even to Europe of their stuff. Wine is big there too. Now, that's important because there's two examples of getting around the law. So if you go back to my last podcast where I was talking about why they want these enhanced subsidies, I'm trying to make the case that in our current system, when people come to the country illegally, now they've got Google and all of this social media, they know and they can look up information just like I just did here. Now, if you're sitting in these other countries and you don't have health care, the government won't do anything for you, it stands to reason that you would want to come to the United States just for that reason. And just to reiterate something, the original programs would help people who made under $50,000 to $55,000 a year for a family of four. They have changed that now. So if you are making over $40,000, you wouldn't qualify for the program. And again, it looks like, based on the evidence, that they are targeting people who are in the country illegally. And to finish this off, I want to reiterate, if you're here legally, then I get it. And you currently qualify for the care. But there are more people here illegally accessing the care that need to come off of that. And when the federal government is looking at this shutdown in healthcare, both sides need to convey their points clearly and be specific, because if people are getting health care that are here illegally, not emergency, if there's an emergency, yes, but regularly, just because they're here illegally, that should not be happening. Let me know what you think. This is Just Listen, hosted by George. Have a great day.